Good morning, all. We will be speaking regarding the extended and expanded role of the nurse. First, we will see the definition of nursing. ICN definition of nursing. Nursing is defined as assisting the individual, sick or well, in performance of those activities contributing to health or to a peaceful death that he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way to help him gain independence as rapidly as possible. Once more, nursing is defined as assisting the individual, sick or well, in performance of those activities contributing to health or to a peaceful death that he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way to help him gain independence as rapidly as possible. Who is a nurse? A professional nurse is a graduate of a recognized nursing school who has met the requirements for a registered nurse in a state in which she is licensed to practice. Next, we will see nursing as a profession. Nursing is not simply collection of skills, and the nurse is not simply a person trained to perform specific tasks. Nursing is a profession. In almost all the countries, nursing practice is defined and governed by law, and entrance to profession is regulated at a national or state level. Professional processes following primary characteristics. A profession requires an extended education of its members as well as a basic liberal foundation. A profession has a theoretical body of knowledge leading to defined skill, norms, and abilities. A profession provides a specific service. Members of a profession have autonomy in decision making and practice. The profession as a whole has a code for practice. Next, we will see the definition of nursing practice. Nursing encompasses autonomous and collaborative care of individuals of all ages, families, groups, and community, sick or well, in all settings. Nursing includes promotion of health, prevention of illness, and care of ill, disabled, and dying people, advocacy, promotion of safe environment, research, participation in shaping health policy, and inpatient and health system management and education are also key nursing roles. The unique function of a nurse is to assist the individual, sick or well, in performance of those activities contributing to health or its recovery that he would perform unaided if he had the necessary strength, will, or knowledge. Next, we will move on to historical roles of a nurse. So, in olden era, that is, its history is as old as the history of woman who, because of her maternal instincts, are always called as born nurses. In ancient period, woman cared for her own family. With evolution of nursing, she took care of members in her own tribe, and with early civilizations, nursing began to be performed outside the home, and their role expanded to care of the sick, infirm, aged, handicapped, as well as health promotion. Throughout the nursing profession's history, nurses have studied and tested new and better ways to help their clients, their families, and communities. Nurses have been leaders in expanding knowledge in nursing. Early in nursing, during the Crimean War, Florence Nightingale studied and implemented methods to improve battlefield sanitation, which ultimately reduced illness, infections, and mortality. Today, nurses are active in determining best practices for skin management, pain control, nutrition status, and care of older adults. Although it is not feasible to describe all of historical aspect of professional nursing, some of the significant milestones are written below. Era of Florence Nightingale. The founder of modern nursing, Florence Nightingale established the first nursing philosophy based on health maintenance and restoration in notes on nursing. What it is and what it is not. She saw nursing role as having charge of somebody's health based on knowledge of how to put the body in such a state to be free of disease or to recover from disease. In the same year, she developed the first organized program for trained nurses at St. Thomas Hospital in London. Nightingale was the first practicing nurse epidemiologist. Her statistical analysis connected poor sanitation with cholera and dysentery. The Civil War to beginning of 20th century. The Civil War stimulated the growth of nursing in United States. Clara Barton, founder of American Red Cross, tended soldiers on the battlefield, cleansing their wounds, meeting their basic needs, and comforting them in death. Dorothy Dix, Mary Ann Ball, and Harriet Tubman also influenced nursing during the Civil War. As superintendent of female nurses of Union Army, Dix organized hospitals, appointed nurses, and oversaw and regulated supplies to the troops. The first African American professional nurse was Mary Maffoy, registered nurse. She was concerned with the relationship between cultures and races. And as a noted nursing leader, she brought forth an aware of cultural diversity and respect for the individual regardless of background. Nursing in hospitals expanded in late 19th century. 20th century. In the early 20th century, a movement towards a scientific research based body of nursing knowledge and practice was evolving. Nurses began to assume expanded and advanced practice roles. Mary Adelaide Nutting, a member of first graduating class at Johns Hopkins Hospital and successor to Isabel Hampton Robb as superintendent of Johns Hopkins Training School, was instrumental in affiliation of nursing education with the universities. She became the first professor of nursing at Columbia University Teachers College in 1907. As nursing educator developed, nursing practice also expanded. In 1901, the Army Corps was established, followed in 1908 by Navy Nurse Corporation. By 1920, nursing specialization was developing. Graduate nurse midwifery program was initiated, and in the late 1940s and early 1950s, specialty nursing organizations such as Association of Operating Room Nurses, American Association of Critical Care Nurses, and Oncology Nursing Society were formed. Hope you understood this much. Next portions will be dealing in next video. Thank you for seeing and subscribing.